Did you know that HPV testing is now considered the preferred way to screen for cervical cancer instead of the traditional Pap test?
Yes, that's because HPV testing is more sensitive at detecting high-risk HPV types that cause almost all cervical cancers, which means it catches potential problems earlier.
I heard a negative HPV test can reassure women that they probably won't develop cervical cancer for several years, sometimes up to 5 years with provider-collected samples.
Exactly, and since HPV tests detect the virus itself, they focus on the root cause, unlike Pap tests that look for cell changes after the virus has caused damage.
What's really interesting is that women can collect their own samples for HPV testing, which could make screening more accessible and less uncomfortable.
Right, self-sampling removes barriers like embarrassment or the need for a pelvic exam, and studies show it increases participation especially among underscreened women.
Are self-collected samples as accurate as those taken by clinicians?
Research indicates that self-collected vaginal samples are generally just as reliable in detecting high-risk HPV as clinician-collected ones.
I guess there are some important things to keep in mind though, like needing follow-up care if the test is positive, right?
Yes, a positive HPV self-test always requires a follow-up exam by a healthcare provider, which might include a Pap test or colposcopy to check for precancerous changes.
And I heard that self-sampling isn't recommended yet for everyone, like women with symptoms or a history of cervical cancer.
That's correct. Current guidelines usually exclude those groups, and while the FDA approved self-sampling in 2024 for healthcare settings, it's not yet the only method used everywhere.
Overall, it sounds like HPV self-screening could really change how women get screened and help catch cervical cancer earlier.
Absolutely, by focusing on the cause and making screening more accessible, it has the potential to increase participation and reduce cervical cancer rates worldwide.